Being a dentist who practices minimal invasive dentistry, I am always looking for ways to help my patients to look after their mouth so that when they do see me for regular checkups the treatment needed will be minimal. The difficulty dentists have with their patients is compliance. I find the best way for this is to get the patients involved in their own oral health, and that begins by informing them of their current dental status and then educate them on how to improve it. The motivation with a lot of them is the prevention of further treatment or the avoiding pain syndrome. The cornerstone of all dentistry must begin with healthy gums, otherwise any restorative work undertaken will fail or even be impossible to do, because if the gums bleed readily due to gum disease, it is very difficult to keep the tooth being restored isolated to place an effective restoration. So gum treatment must ideally begin immediately to arrest any further destruction of gum and or bone loss around the teeth. Most people brush well, but unless they use dental floss or some other means of cleaning in between their teeth, then caries and gum disease is more than likely to be apparent. Brushing alone leaves two tooth surfaces untouched and therefore unclean, and these are the tooth surfaces in contact with the adjacent ones. A common trait for a lot of people, including myself, is that we want things easy in life, as we all have busy lives doing what we need to do on a daily basis, and if we need to do something else on top of an already busy daily regimen, it needs to be quite important enough to do in the first place, as well as being relatively easy to do. A majority of people find flossing time-consuming, fiddly and too troublesome to continue for long unless they feel there is food trapped between teeth. There are those who are not able to use floss as they have lost the dexterity in their fingers or have trouble with gagging when reaching too near the back of the mouth. Interdental brushes work well with large gaps between teeth, as the use of wood sticks is used carefully, avoiding poking the gums. The method of choice for nearly all my patients is the use of the water jet or water pick. Water jets are very effective in removing plaque from around the necks of teeth, but the key aspect is that it flushes food debris and plaque from below the gum line and is much more effective than the use of floss. With the fine tips available with a water jet, it is especially very good for those patients with partially erupted lower third molar teeth, wisdom teeth, where it gets right back and cleans under the gum. A study in 2005 by Barnes C.M. et al. Showed that the use of the water jet gave quite impressive results in reducing bleeding, up to 93%, and gingivitis, up to 52%, compared to the use of floss. Another study in 2009 by Guerra et al. Has shown that a 3-second pulsation with a water jet was highly effective in the removal of plaque biofilm from tooth surfaces, an amazing 99.9%. Therefore I advocate the use of the water jet to all my patients, because it is my responsibility in my total care for them to help them understand the importance of a daily regime they can easily use and follow and sustain, and thereby reducing the need for physical intervention and treatment.